I should have prefaced my speech actually to say that I really don't have answers. Maybe that's what Dr. Larson thought that I would have in coming here. I don't have any answers. Surprise. I'm looking for all of you to help come up with the answers, with the solutions. And today I just want to give you some ideas from Baltimore. Everything that we do is a work in progress. We've started a lot of projects. We have a lot of things that we believe are going in the right direction, but we don't know. And research and metrics and evaluation will be important to us getting there, but also having your input will be important too. So I want to give you just 3 examples of things that we have done, and I would love to hear your thoughts about that later. So I want to start with one problem. First problem is infant mortality. You know, we in Baltimore, just as I imagine all of you, we believe in starting as early as possible and giving our kids every opportunity. Yet, in 2009, I'll give you a couple of statistics here, seeing all the researchers who are in the room. In 2009, Baltimore had one of the worst infant mortality rates in the country. If you compared infant mortality in Baltimore at the time, we were on par with countries in the middle of civil war. And when you looked at disparities, it was so horrific. So this statistic I find so jarring. I almost can't say it, but the likelihood of African American babies to die as infants was 5 times as it was for white babies. If at the time you asked leaders in our city what the issue was, everybody would have said lack of resources, which is a true statement. I mean, I don't, you know, if for any of you who are donors out there, we're still short of resources now. We would never say that we have too many resources. But there was another issue too, which was that as we looked around the city and identified issues, we saw that there were over 100 different groups that were working on maternal and child health and improving outcomes in some way. And these were groups that were doing great work. There were sororities, fraternities, there were church groups, there were neighborhood associations that were going door to door. There were hospitals and clinics, and I mean, there were great things that were happening. And individuals may have been helped. But what if 80% of the services were delivered to 10% of the population? What was the coordinated strategy to make sure that we were actually moving the needle as a city? So as a result of recognizing this, the health department formed a coalition of over 150 partners, which was very challenging because everybody wants to do their own thing. They have their own program set up that they're very proud of. And so it took years for this coalition to be formed. But the health department in the city basically set a strategy, a North Star, which I believe that we must have, because we have to break down these silos in order to get everybody on the same page. And so we had a North Star, and the goal actually is as simple as it gets, as objective as it gets, because infant mortality, pretty basic and pretty important to measure. We set that as the goal, got all the partners on board, including with a strategy for universal triage. Every pregnant woman on Medicaid gets triaged to a central system. And then it's determined what level of services they should get, from nurse home visiting to social workers to community health workers. They all got some type of services. We did the ABCs of safe sleep everywhere in our communities, delivered cribs, did breastfeeding classes, hired many individuals who are from the communities that they come from in order to do peer education. As a result, within 6 years, infant mortality dropped across the city by 28%. Number of babies dying in their sleep reduced by half. And the disparity between black and white infant mortality closed by 40%. We also did reproductive health education, by the way, and provide services. We were talking about this last night. I had the opportunity to present to the National Physicians Alliance, and thank Dr. Meyer for that invitation. But had the opportunity to also talk about the importance of reproductive health, and we provide reproductive health services actually in many of our schools, among other places. And so as a result, the teen birth rates in that same period dropped by 36%. So I give this example not because we've solved the problem. Certainly we have a long way to go before we even match the data for the rest of Maryland and other similar urban cities. But I also think it's important for us to talk about our successes, for us to talk about what's worked, and to be able to learn from it. And in this case, this is something Be More for Healthy Babies is one of our signature programs because it illustrates why it is so important for us to break down these silos, to have that shared goal, and to work towards that common outcome.